Trigeminal autonomic neuralgia for me uh, is the headache in the trigeminal nerve distribution, especially in the ophthalmic division, and which is associated with the autonomic symptoms like ptosis, conjunctival injection, tearing, nasal block, or rhinorrhea. So if there is a combination of the unilateral headache and the autonomic symptoms, then as a clinician, we'll think of the trigeminal autonomic cephalesia. The components of the trigeminal autonomic cephalesia are the cluster headache, paroxysmal hemicrania, and the shunt. The cluster headache is a disease of the young adult. It's more common in the male population. The classical feature of the cluster headache is that it shows the periodicity, mean that it occurs in particular time of the day or particular time in a year. Let's suppose if the person is having the cluster headache today at starting from 8 a.m. to 11 a.m., then again the patient is going to have the cluster headache at the same time, probably after a few days or after a few months. Because of the cluster headache, person has to wake up frequently, even in the night time. The classical feature of the cluster headache is that when the person is having the cluster headache, it is of severe intensity and person becomes so restlessness, in contrast to the headache of the migraine, where the patient likes to stay still. Usually the cluster headache is precipitated by the alcohol. Paroxysmal hemicrania usually occur in the age group of 30 to 40s. The ratio of male is to female is 1:1. It shows the similar pattern of the headache as that of the cluster headache, but definitely there will be the more frequent attack. And the classical thing of paroxysmal hemicrania is that it is highly responsive to the indomethacin therapy. Once you take the indomethacin, there will be a drastic response to that medications. Shunt is characterized by the unilateral headache, especially in the orbital area, associated with conjunctival injection and tearing. Person usually have the only diurnal attack. They do not have the nocturnal attack. They can have the more than 100 times attack in a day, and the person with the shunt have some trigger zone for initiation of the attack. The cluster headache, when you are treating the cluster headache, there are abortive treatment as well as the preventive therapies. The abortive therapy, which shows the maximal efficacy, is the oxygen therapy. When the person is having the attack of cluster headache, if you give the oxygen at the rate of 5 to 10 liters per minute, then there will be the relief of the headache. Other abortive medications that can be given in a patient with cluster headache are the zolmitriptan, sumatriptan subcutaneously, Argotamine and the lignocaine intranasally can be tried for the management of the cluster headache. If someone is having the chronic cluster, then the verapamil is a drug of choice. Before onset of the verapamil, the breathing by the steroid may require. Other therapies that can be tried is the valproate, topiramate, and melatonin. The paroxysmal hemicrania is treated with the indomethacin therapy. This shows the drastic response to the indomethacin. The shunt is treated by lamotrigine therapy, and usually it responds to the lamotrigine.